If you're over 60, what I'm about to reveal might shock you. After speaking with countless healthcare professionals, I uncovered a troubling truth about how older patients are often viewed in medical settings. These hidden realities can affect the care you receive, the respect you're given, and in some cases, even how long you live. One retired physician described it as the worst kept secret in healthcare. Ignoring it can put your safety at risk. That's why this video exists, to show you what's really happening behind closed doors and how you can protect yourself at your next appointment. Today, I'll expose 5 uncomfortable truths about medical ageism, biases that quietly shape diagnoses, treatments, and professional attitudes toward older adults. Here's the roadmap. First, the mental shortcuts triggered the moment your age appears on a chart. Second, the financial pressures shaping treatment choices. Third, how your symptoms get filtered through stereotypes. Fourth, the prescribing practices targeted at older adults. And finally, the mistaken assumptions about mental sharpness that undermine the quality of your diagnosis. But this isn't just about problems, it's about solutions. I'll also share strategies that seniors use to command respect and receive top-level care. If you've ever felt dismissed, rushed, or unheard by a doctor, you'll leave this video with tools to change that experience. Hit the like button now so more people discover this message, and subscribe with notifications on, because what you learn here could literally save your life. And share in the comments the most frustrating experience you've had with healthcare. So let's begin with the first ugly truth. Many doctors label older patients as expensive or complicated before you even sit down. Simply walking into the office triggers this invisible category. Medical training emphasizes time management, and seniors are automatically seen as resource-heavy. It's not always malicious. It's a bias ingrained in the system. Older patients are assumed to need more tests, longer visits, and multiple prescriptions, and that prejudgment colors the entire interaction. Economic pressure only makes it worse. With lower reimbursements and higher patient quotas, many doctors feel overwhelmed when treating seniors. The result? Research shows that patients over 65 get nearly 25% less active listening time compared to younger adults with identical complaints. Take the case of Marjorie, a 74-year-old retired librarian. She carefully tracked her symptoms in a notebook and brought them to her appointment. Yet before she could finish her first sentence, her doctor cut her off, insisting she focus on just one concern. Her chest pain was dismissed as anxiety, delaying a heart diagnosis by 6 months. To counter this bias, start every appointment by stating a measurable health goal. Instead of saying, "I feel tired," say, "My energy has dropped about 40% over the past 3 months, and I want to understand why." Bring a 1-page summary of your health history, highlighting progress from prior treatments. This reframes you from a complicated patient to a goal-driven one. When you show up as an active participant in your care, not just a passive recipient, doctors change how they interact with you. Healthcare professionals genuinely respond better when they see patients as partners rather than problems. A simple but effective tactic is to negotiate time to address what matters most. For example, you could say, "Doctor, I know our time today is short. Could we schedule a 30-minute appointment next week to fully discuss my heart concerns?" This shows respect for their schedule while making sure your needs are prioritized. Another smart habit is to take notes during the visit. When a doctor sees you writing things down, it signals that you're paying attention and will hold them accountable. That accountability often changes the way they explain things and the care they provide. But one of the most common and harmful problems older adults face is medical gaslighting, when real symptoms are brushed aside as just aging. It has become so normalized that many doctors don't even realize they're practicing a subtle form of discrimination. Geriatrician Dr. Miguel Torres, who spent his career fighting age bias in medicine, puts it plainly, saying, "It's just your age" has become a medical cop-out to avoid deeper investigation. The statistics are staggering. Research from the American Geriatric Society shows that 85% of serious conditions in seniors are initially misattributed to aging before receiving a proper diagnosis. Heart disease gets dismissed as fatigue. Thyroid disorders are mistaken for natural energy decline. Depression is brushed off as an adjustment to aging. Even cancer symptoms are waved away as wear and tear. Consider the case of Carl, a 67-year-old former construction supervisor. For 8 months, he reported increasing stiffness and fatigue to his doctor. Each time he heard the same line, "Carl, you're not 30 anymore. Your body is slowing down." When he finally demanded blood tests, the results revealed advanced rheumatoid arthritis that had already caused irreversible joint damage. Gaslighting follows predictable patterns. Doctors use phrases like, "That's expected at your age," or "We all slow down," to deflect attention from a thorough workup. Instead, they suggest generic fixes: exercise more, sleep better, reduce stress, without investigating why these issues appeared so suddenly. Women often face double discrimination, with their symptoms attributed both to aging and to hormonal changes. Men's concerns about emotional shifts or sexual health are waved off as normal male aging. The psychological damage is profound. When authority figures constantly tell you something alarming is normal, you start doubting your own judgment. That self-doubt delays care and leads to worse outcomes. Here's how to protect yourself. Always counter age-based dismissals with precise questions. Ask, "What percentage of people my age experience this exact symptom? What studies show this is typical?" Most doctors won't have solid evidence, because they're making assumptions, not medical assessments. Another defense is to create a symptom timeline. Don't just say, "I've been more tired lately." Say, "Until March 15th my energy was stable. Since then I've needed daily naps for the first time in my life." That reframes your concern from a vague aging complaint into an acute change that demands attention. And never hesitate to ask, "If I were 40 with these same symptoms, what tests would you order?" This question forces doctors to confront their bias, and often leads to more appropriate investigations. One of the strongest statements you can use during an appointment is, "Doctor, I understand aging affects energy, but this change is significant compared to my usual baseline. I'm worried it could point to an underlying condition. What diagnostic steps can we take before labeling it as age-related?" Speaking this way shows awareness and forces evidence-based reasoning rather than assumption. Another powerful strategy is bringing an advocate. When a second person is in the room, doctors often change their tone, becoming more attentive. That companion can also ask follow-up questions, take notes, and ensure key details aren't ignored. If you've ever experienced being brushed aside, share it in the comments and hit like so others learn they're not alone. Now, let's expose one of the most damaging biases: the assumption that all older adults are cognitively impaired. Many providers automatically believe seniors can't follow complex treatment plans. The result? Oversimplified explanations, fewer options presented, and critical decisions made without patient input. Neuropsychologist Dr. Amanda Ribeiro, who researches medical bias, has shown that providers routinely underestimate the mental abilities of patients over 65. Instead of offering advanced therapies, they default to simpler treatments, trapping seniors in a cycle of limited care. Less information leads to fewer choices, which leads to poorer outcomes. Consider the case of Louisa, a 71-year-old retired chemistry professor. When diagnosed with early-stage breast cancer, her oncologist recommended only a simple mastectomy. His justification: "At your age, we should keep things straightforward." She had to fight for months before gaining access to advanced therapies already offered freely to younger women with the same condition. This prejudice appears in subtle ways. Doctors slow their speech, use overly basic vocabulary, and skip technical explanations, even when patients demonstrate intelligence and education. They often avoid prescribing more effective drugs with complex dosing schedules, assuming seniors can't handle them, and instead give once-daily medications that are less effective. Technology bias makes things worse. Many assume seniors can't use health apps, digital records, or online portals, cutting them off from tools that could improve treatment outcomes and communication. The psychological toll is severe. After repeated experiences of being spoken down to, some older adults start believing they're incapable of understanding. This creates dependency that never needed to exist. But you can break this cycle. Begin each appointment by highlighting your background or experience. Say something like, "I managed complex projects for decades, so I need complete technical details." Don't be afraid to request medical terminology and explanations of how each treatment works. Bring printed research, pre-written questions, and notes from prior consultations. This preparation shows undeniable evidence of your capacity. And if you're given oversimplified recommendations, challenge them directly and ask for every available option. That insistence forces providers to abandon stereotypes and treat you as a fully capable partner in your healthcare. A powerful question to dismantle bias is, "Doctor, if I were 45 with this same condition, what additional therapies would you recommend? I want to understand all the available options, no matter how complex." Framing it this way signals that your age should never be used as a shortcut to limit your care. Use technology proactively during your appointments. Open your health apps, reference your digital records, or check medication interactions on your smartphone right there in the room. When providers see you're comfortable with technology, it directly challenges their assumptions about what seniors can or cannot do. Always request detailed written treatment plans and medication information. Tell them clearly, "I want comprehensive documentation so I can review each recommendation thoroughly." This makes it obvious that you intend to be an informed participant, not a passive observer. But here's where things get especially troubling. Medications are often prescribed as a way to control behavior, not to treat actual medical conditions. Far too often, psychiatric drugs, sedatives, and mood stabilizers are given to older adults simply because they make patients easier to manage in hospitals or care facilities. Dr. James Martinez, a former nursing home medical director turned patient advocate, has exposed this practice. He recounts seeing countless seniors medicated not for health improvement but to reduce staff workload. Anxious patients were given sedatives, assertive ones were prescribed mood stabilizers, and those who asked too many questions ended up with antidepressants. In reality, this is chemical restraint disguised as medical care. The statistics are staggering. Over 40% of older adults take at least one psychiatric medication, yet only 12% have a diagnosed mental health condition that requires it. The rest of these prescriptions serve administrative convenience. Meanwhile, the side effects are dangerous. Falls, confusion, cognitive impairment, and even increased mortality risk. Take the story of Beverly, a 69-year-old retired school principal. After hip surgery, she became frustrated with her slow rehabilitation and began asking detailed questions. Staff labeled her difficult and prescribed anxiety medication. The drug caused confusion and balance problems, leading to a fall that broke her wrist. What should have been a straightforward recovery was extended by 4 additional months because of complications from unnecessary medication. This pattern extends beyond psychiatric drugs. Sleeping pills are routinely prescribed for normal age-related changes in sleep cycles, not actual disorders. Legitimate pain complaints are minimized, with doctors withholding analgesics under the assumption that patients are exaggerating. Blood pressure medications are sometimes given at doses that cause dizziness and fatigue, leaving seniors less active and more vulnerable. The cruelest part is how these drugs can create the very problems they're supposed to treat. Sedatives may trigger confusion that gets mislabeled as dementia. Mood stabilizers can cause apathy that's mistaken for depression. Sleep aids disrupt natural rhythms, producing real sleep disorders that require even more medication. Healthcare systems often encourage this because sedated patients need less staff time, and insurance companies prefer cheaper medications to proper therapies. Sometimes even families request it, struggling to cope with their loved ones' emotional responses. Your defense begins with one essential step. Demand to know exactly what each medication is for and insist on a clear medical justification for its use. Before agreeing to any prescription, ask direct questions. What exact condition is this medication treating? What objective markers will show it's working? When will we know it's time to stop? Avoid drugs prescribed for vague reasons like anxiety or agitation without clear diagnostic criteria. Research every medication yourself using reliable databases. Check for side effects, possible interactions, and alternative approaches. Many behaviors that trigger psychiatric prescriptions can actually be addressed through environmental changes, therapy, or by treating underlying health conditions. Always demand measurable goals and time frames. Say, I want specific targets for this medication. If I don't see clear improvements within a set period, I'd like to discontinue and explore other options. This prevents open-ended use of psychiatric drugs. Also, request medication reviews with independent pharmacists or geriatric specialists. These professionals are skilled at identifying unnecessary drugs, spotting dangerous combinations, and finding opportunities for deprescribing. Many seniors are shocked to learn they're taking medications with little or no therapeutic value. Document your cognitive and physical abilities before starting any psychiatric drug. Take baseline memory tests, balance checks, and mood assessments. This record helps you detect medication-induced changes and provides solid evidence if you need to argue for stopping treatment. Build a support system too, someone you trust who can speak up if medication affects your judgment or assertiveness. That advocate ensures your voice is heard even if side effects alter your personality or mental clarity. Now for one of the harshest realities. Behind the scenes, many providers calculate the value of your life when recommending treatments. Ethics professor Dr. Patricia Chan has revealed how concepts like quality-adjusted life years, taught in medical training, assign numerical worth to different lives. In practice, a 70-year-old's remaining years are considered less valuable than those of a 40-year-old. This influences everything from organ transplant approvals to cancer treatment plans. The result? Seniors are often denied expensive procedures, advanced diagnostics, and aggressive therapies, not because they wouldn't benefit, but because the system deems the investment unjustified. The same surgery offered to younger patients is labeled too risky or not cost-effective for older adults in identical health. Take Walter, a 68-year-old retired engineer. Diagnosed with kidney failure, he was steered toward palliative care and told dialysis might not be appropriate for his age. He fought for 3 months to access treatment routinely offered to younger patients. Once on dialysis, he regained his activity levels and lived 7 more productive years, years he would have lost if he'd accepted the initial recommendation. The discrimination extends to mental health. Depression and anxiety in seniors are too often dismissed as natural parts of aging, rather than treated with the same therapies younger patients receive. Therapy, psychiatric care, and even medication are sometimes considered wasteful for those assumed to have limited time left. The tragedy deepens when older adults start believing their lives are worth less. When older adults stop pushing for aggressive treatments and accept substandard care, it's often not a choice but the result of internalizing society's devaluation of their lives. Nowhere is this clearer than in emergency rooms. Seniors presenting with the same symptoms as younger patients are given fewer tests, shorter evaluations, and faster discharges. Many ER doctors admit privately that age influences their decisions, even though it has no scientific justification. The economic bias becomes especially cruel in family discussions. Healthcare providers often nudge families toward cheaper options, framing them as comfort measures or age-appropriate care. Families may accept these limits without ever knowing all the available alternatives. But here's the truth. Your life holds equal value at any age, and you must advocate for it. A simple but powerful question is, would you recommend the same treatment if I were 45? If the answer is no, demand medical, not economic, reasons for the difference. Research treatment outcomes for people your age. Many seniors respond just as well as younger patients, and presenting this evidence in consultations strengthens your case. Always insist on access to all therapies, regardless of cost. Seek multiple opinions, especially from geriatric specialists who understand how older adults benefit from advanced treatments. Conditions that general practitioners often label as comfort care only can frequently be managed effectively by age-focused specialists. And don't hesitate to use legal advocacy if necessary. Age discrimination in healthcare violates established rights, and senior advocates can help secure treatments that were unfairly denied. Keep detailed records of moments where age seemed to influence recommendations. Connect with senior advocacy organizations for support and guidance through appeals and alternative options. Remember, you have the right to reject so-called age-appropriate limits. If you want comprehensive diagnostics, advanced therapies, or aggressive treatment, you can demand equal access. Now you've learned the 5 disturbing truths about medical ageism. More importantly, you've gained the strategies to transform every medical encounter, from passive patient to empowered advocate. Think of Walter, who fought for dialysis and gained 7 more fulfilling years, or Beverly, who overcame medication-induced setbacks to reclaim her recovery. These aren't rare exceptions. They're what happens when seniors refuse to accept discriminatory care. Every time you challenge stereotypes, demand equal treatment, or insist on thorough care, you're not just fighting for yourself. You're reshaping how the system treats all older adults. Your determination creates ripple effects that benefit everyone who comes after you. The medical establishment hopes seniors stay quiet and compliant. But you're different now. You recognize the bias, understand the discrimination, and hold the tools to fight back. Your health, dignity, and remaining years are far too valuable to surrender. Transform your healthcare experience starting today. Insist on care based on your individual needs, not on ageist assumptions. If you've ever experienced medical ageism, share your story in the comments. Have you faced it? What will you do differently next time? Like, share, and subscribe with notifications on, because every senior deserves dignity, respect, and life-saving medical care, no matter their age.